There is a particular kind of interruption that arrives without warning, a sharp, cramping pain in the calf that wakes you in the middle of the night, a sudden lightheadedness when you stand from a chair, the quiet, mounting anxiety that comes with a blood pressure reading that seems to creep higher each year. For millions of adults between middle age and their later years, these are not isolated inconveniences, but recurring disruptions that chip away at sleep, mobility, and confidence. They are also symptoms that are often treated separately. A pill for blood pressure here, a magnesium tablet there, while the everyday habits that shape circulation and muscle function go unexamined. What we drink, often several times a day, is one of those habits, and it turns out to be far more powerful than most people realize. This video begins with a simple premise. Small, sensible changes to what you put in a glass can have measurable effects on vascular health, electrolyte balance, and muscle function. That is not wishful thinking. Behind this premise are well-established physiological principles. Vascular tone, the degree of constriction or relaxation of our blood vessels, responds to chemical signals that can be influenced by dietary compounds. Muscle excitability and the tendency to cramp depend on the balance of key minerals such as potassium and magnesium, and on adequate hydration. Anti-inflammatory plant compounds and certain dietary nitrates can improve endothelial function, the microscopic lining of the arteries that dictates how smoothly blood flows. Taken together, these mechanisms explain why some beverages can, over time, help lower blood pressure and reduce the frequency of leg cramps, especially in older adults whose vascular resilience and mineral stores are more fragile. This is a practical, not a theoretical conversation. In the next chapters, I will present 5 beverages that combine scientific plausibility with real-world accessibility, options that are inexpensive, generally safe for most adults, and easy to incorporate into a daily routine. For each drink I will explain, in straightforward language, the physiological reasons it can help. I will describe the most effective ways to prepare and consume it. And I will flag sensible precautions, for instance, potential interactions with medications, or how people with diabetes or kidney conditions should proceed more cautiously. The goal is not to replace medical care, but to offer evidence-informed, actionable choices that can complement the care you already receive from your physician. Before we move on, 2 important notes. First, this material is intended to inform and empower, not to prescribe treatment. If you are on medication for blood pressure, a diuretic, or any drug that affects potassium or magnesium levels, consult your clinician before making substantial changes. Second, this content is geared toward adults between roughly 35 and 70 years old who are looking for realistic, sustainable ways to improve daily well-being, better sleep, fewer cramps, steadier blood pressure, and a greater sense of ease. The voices you will hear in this video are those of science-informed explanation and practical guidance, clear, respectful, and attuned to the worries that often accompany aging. As the years pass, the body's internal balance begins to shift in ways that are both subtle and consequential. The cardiovascular system, which once handled changes in posture or temperature with ease, gradually loses some of its flexibility. Arteries that were supple in youth slowly stiffen as their elastic fibers degrade and calcium accumulates in their walls. This process, known as vascular aging, makes it harder for the body to cushion each heartbeat's surge of pressure. What once required only a gentle widening of the arteries now demands more effort, leading to chronically higher readings on the blood pressure monitor. At the same time, the kidneys, the body's mineral regulators, become slightly less efficient at conserving key electrolytes such as potassium and magnesium while removing excess sodium. The result is a quiet, creeping imbalance that encourages fluid retention, constricted blood vessels, and muscle irritability. Add to this the influence of modern life, long hours sitting, less physical labor, processed foods that overflow with sodium and sugar, and daily stress that keeps adrenaline circulating far beyond what the body was designed to handle. Together, these factors create the perfect environment for hypertension to develop and for muscles, especially in the legs, to spasm during rest. Nocturnal cramps, those sudden knots of pain that wrench you awake, are not merely random. They are the body's desperate reaction to poor circulation, electrolyte loss, and nerve hypersensitivity. Even mild dehydration, the kind that develops quietly over hours of forgetfulness, can make muscles more prone to contract involuntarily. Many older adults drink less water than they should simply because the sensation of thirst diminishes with age, or because they fear nighttime urination. The paradox is that avoiding fluids to preserve sleep may actually be what disrupts it. In the background of these mechanical and chemical changes, a silent player exerts tremendous influence: nitric oxide, a simple molecule produced by the cells lining our arteries. It acts as a messenger that tells blood vessels when to relax. Levels of nitric oxide naturally decline after the age of 40, and this reduction contributes to both higher pressure and colder extremities. The encouraging news is that certain foods and drinks can stimulate its production again. By supplying natural nitrates, antioxidants, and specific amino acids, these beverages help restore the language of relaxation that aging arteries sometimes forget. Understanding this physiology reframes the conversation. Rather than viewing high blood pressure and cramps as unrelated annoyances, we begin to see them as two expressions of the same imbalance: constricted vessels, fatigued muscles, and missing minerals. This understanding is crucial because it points toward a holistic solution. If we can support circulation, hydration, and mineral balance simultaneously, we can relieve both problems with the same gentle interventions. And those interventions often begin not with a pill, but with what we drink. So now that the biological foundation is clear, it's time to turn to the practical side of this story: the 5 drinks that science and experience have shown to be effective allies for vascular and muscular health. These are not exotic remedies or expensive supplements. They are simple beverages that anyone can prepare at home, often from ingredients already sitting in the kitchen. Each drink has its own unique mechanism. One boosts nitric oxide, another restores lost electrolytes, another calms inflammation or supports magnesium intake. Taken together, they form a small but powerful toolkit for everyday well-being. Before revealing the first one, it's worth remembering why this matters so deeply. When blood pressure stabilizes and circulation improves, energy levels rise. The brain receives oxygen more efficiently, balance becomes steadier, and those sudden cramps that interrupt the night start to fade. The goal is not perfection, but progress, a return to the quiet, predictable comfort that good health once gave you. These drinks are simply instruments for achieving that. Let's begin with the first and perhaps most scientifically celebrated of them all: the vibrant crimson liquid that has earned the nickname nature's blood pressure medicine. It's rich, earthy, and more powerful than it looks: beetroot juice. And before we go deeper, if you find this kind of clear, science-based guidance valuable, the kind that turns complex health topics into simple, actionable steps, take a moment to subscribe to this channel. Your support allows this community to grow and helps more people discover natural, evidence-based ways to improve their health. Now let's explore exactly why beetroot juice has captured the attention of researchers and doctors alike. Beetroot juice is not just a colorful addition to the diet. It is, in many ways, one of nature's most sophisticated cardiovascular tonics. The beet's deep crimson hue comes from a class of pigments known as betalains, powerful antioxidants that protect cells from oxidative stress. Yet the real secret of this root lies not in its color, but in its chemistry. Beets are exceptionally rich in inorganic nitrates. Natural compounds that once ingested are converted by bacteria in the mouth and enzymes in the body into nitric oxide. This simple molecule is the body's master signal for vascular relaxation. It tells arteries to open slightly, improving blood flow and reducing the resistance that causes pressure to rise. In clinical studies, adults who drank a modest glass of beetroot juice daily experienced measurable reductions in systolic blood pressure, sometimes as much as 10 points within a few hours. For people whose arteries have lost elasticity with age, this is not a small achievement. Lowering blood pressure even slightly can decrease the strain on the heart, protect the delicate vessels of the brain and kidneys, and reduce the risk of stroke. The benefits extend beyond the heart. When circulation improves, oxygen delivery to muscles also becomes more efficient. For those who suffer from leg cramps, especially at night, this means less stagnation of blood in the lower limbs, faster clearance of metabolic waste, and muscles that contract and relax with greater ease. The beauty of beetroot juice is its simplicity. Half a medium-sized beet blended with water or mild fruit juice is often enough. For a smoother flavor, many prefer to combine beet with apple, carrot, or lemon. The effect depends more on regularity than on volume. A small serving consumed consistently works better than sporadic large amounts. It is best taken during the day rather than at night, since it can have a mildly energizing effect. For people with diabetes, moderation is wise. Beets contain natural sugars, though their glycemic index is moderate. Those on blood-thinning medication should also consult their doctor, as the nitrates can modestly influence circulation and clotting dynamics. What makes beetroot juice particularly fascinating is how it operates as a gentle, natural counterpart to certain blood pressure medications, without the side effects of fatigue or dizziness. It does not force the arteries to relax. It invites them to, by providing the raw materials the body needs to restore its own regulation. Over time, as the cells lining the arteries rebuild their sensitivity to nitric oxide, the system becomes more self-reliant, and the effect persists even if a dose is missed. This quiet repair process is what gives beetroot its reputation among researchers as food therapy for the endothelium, the inner skin of our vascular system. If beetroot juice serves as a reinforcer of circulation, then coconut water serves as the replenisher of minerals. Where beets act on the blood vessels, coconut water acts within the cells themselves. It is nature's electrolyte solution, light, refreshing, and remarkably balanced. In a single glass, it provides substantial amounts of potassium and magnesium, two minerals that are essential to both blood pressure regulation and muscle relaxation. Potassium, the dominant intracellular ion, helps the body excrete excess sodium, reducing water retention and easing the workload on the heart. Magnesium, meanwhile, modulates nerve transmission and prevents the overexcitation of muscle fibers that leads to cramps. In older adults, low magnesium levels are surprisingly common. Diuretics, often prescribed for hypertension, tend to flush magnesium from the body. Over time, this depletion increases not only the risk of cramps, but also the instability of heart rhythm. Coconut water quietly counteracts this loss. A modest glass, about 200 milliliters, provides enough to restore equilibrium without overwhelming the kidneys. For those living in warmer climates or engaging in light exercise, it also compensates for minerals lost through sweat. But its benefit is not limited to the tropical heat. Even in cooler seasons, coconut water can help maintain steady hydration throughout the day, especially for those who dislike plain water. The timing of consumption matters. Many people find that drinking half a glass of coconut water in the early evening, perhaps an hour before bedtime, reduces the frequency of nocturnal cramps. It relaxes the legs and helps the nervous system wind down. However, moderation remains important. Packaged versions, especially those with added sugar or flavoring, can defeat the purpose by raising blood glucose or sodium intake. The best option is fresh or unsweetened coconut water, the kind that tastes mildly sweet but leaves no sticky residue on the tongue. There is something quietly symbolic about these first two drinks. One acts on the arteries, widening the pathways that carry life's fluid. The other nourishes the fluid itself, replenishing what time and medication often drain away. Together they form the foundation of vascular and muscular balance. And while they are profoundly simple, their effects can be profound. In clinics across the world, nutritionists increasingly recommend them not as quick fixes, but as daily rituals, ways of supporting the body's internal rhythm so that medication, if still needed, works more effectively. When we treat food and drink not as incidental pleasures but as biochemical tools, our perspective shifts. We stop asking, "What can I take for my symptoms?" and begin asking, what does my body need to function smoothly? This question opens the door to the remaining drinks, each addressing a slightly different piece of the puzzle: inflammation, relaxation, and cellular nourishment. The next one is perhaps the most soothing of them all, known in traditional medicine as the red medicine for the heart. It is not a fruit juice, but a tea, crimson and fragrant, capable of lowering pressure and calming the body at once. That drink is hibiscus tea. There is something almost ceremonial about a cup of hibiscus tea. The way the dried petals bloom in hot water, releasing a deep red color that glows like garnet, seems to mirror the way it acts within the body, opening, softening, restoring balance. Long before laboratories confirmed its effects, traditional healers across Africa, Asia, and Latin America used hibiscus to calm the heart and cool the body after heat or exertion. Today, modern science has caught up with this wisdom. Clinical studies have shown that drinking hibiscus tea regularly can lower both systolic and diastolic blood pressure, often with an effect comparable to mild antihypertensive medications, but without the chemical burden. The active components of hibiscus are compounds known as anthocyanins and polyphenols, the same family of antioxidants found in blueberries and pomegranates. They protect the endothelial cells that line the arteries, reduce inflammation, and encourage the vessels to relax. Hibiscus also acts as a gentle diuretic, helping the body eliminate excess sodium and fluid. The combined result is a sustained, natural reduction in blood pressure that feels smooth rather than abrupt. People who drink it often describe a sense of warmth followed by calm, as if the tension within the chest eases slightly with each sip. But hibiscus tea offers more than cardiovascular support. It also plays a quiet role in preventing leg cramps. The same flavonoids that benefit blood vessels also help muscles recover from microinflammation, the kind that builds up after daily use or prolonged standing. The slight diuretic effect, when balanced with proper hydration, can help prevent the edema, that subtle swelling in the ankles, that often precedes nighttime cramping. Moreover, because hibiscus tea contains no caffeine, it can be consumed in the evening without interfering with sleep. In fact, its subtle acidity and warmth often have a mild sedative effect, promoting relaxation at bedtime. Preparation is simple, but deserves care. The key is not to overboil the petals. Pour hot, not boiling, water over a teaspoon of dried hibiscus and let it steep for 7 to 10 minutes. Strain and drink it warm or chilled. Adding a touch of honey or a squeeze of lemon is optional, but enhances both taste and absorption of antioxidants. 2 cups a day are enough for most adults. 1 in the afternoon to stabilize pressure, and 1 before bed to soothe muscles. Those with low blood pressure or on certain medications should monitor their readings, as the effect can be more potent than expected. For the rest, hibiscus tea represents one of the simplest ways to harmonize the cardiovascular and nervous systems through something as gentle as a cup of tea. If hibiscus tea relaxes the heart and blood vessels, the next drink relaxes the body from within. It does not come from a single plant, but from the combination of several, each bringing minerals and nutrients that restore what aging or stress tends to deplete. It is a smoothie rich in magnesium, a mineral often described as the spark of life, because it participates in more than 300 biochemical reactions. Magnesium stabilizes nerve impulses, keeps muscles from contracting uncontrollably, and assists the production of energy in cells. When magnesium is low, the first signs are subtle: twitching eyelids, restless legs, interrupted sleep, or that familiar cramp that strikes at dawn. The beauty of a magnesium-rich smoothie lies in its simplicity and synergy. In a single blend, you can unite ingredients that naturally contain the minerals and compounds your body most needs to restore equilibrium. One of the easiest and most effective recipes combines a ripe banana, a handful of fresh spinach, a tablespoon of chia seeds, and a cup of almond milk. Each component contributes something unique. The banana supplies potassium, essential for balancing sodium and keeping muscles supple. Spinach brings a generous dose of magnesium and small amounts of calcium that work together to regulate contraction and relaxation. Chia seeds add omega-3 fatty acids that reduce inflammation and help stabilize cell membranes, while almond milk provides gentle fats that slow absorption, keeping energy stable rather than spiking blood sugar. This combination creates more than a drink. It becomes a form of nutritional therapy, taken regularly, in the morning as breakfast or in the afternoon as a light meal. It replenishes the minerals that aging, medication, or chronic stress often drain. The smooth texture and mild sweetness make it pleasant even for those who struggle with appetite or digestion. What truly makes it valuable, however, is its cumulative effect. Within days, many people notice that their legs feel lighter, their heartbeat steadier, and their sleep deeper. Magnesium works like a natural tranquilizer for the nervous system, quieting overactive muscles and signaling to the brain that it is safe to rest. From a physiological standpoint, the smoothie supports 3 systems at once: vascular, muscular, and neural. The potassium and magnesium relieve arterial tension, the omega-3s protect vessels from inflammation, and the amino acids in the plant-based milk assist tissue repair. When consumed regularly, this drink can subtly raise the body's baseline of relaxation, reducing both the frequency and intensity of cramps and the tendency of blood pressure to surge under stress. The key is to make it a ritual rather than a remedy, a small daily act of nourishment that replaces processed snacks or sugary drinks. Unlike many health fads that promise instant results, the magnesium-rich smoothie operates with quiet consistency. It doesn't shock the system, it supports it. And in doing so, it helps restore the smooth rhythm between the body's electrical and muscular systems, allowing both heart and muscle to work with less friction. In this way, hibiscus tea and the magnesium smoothie share a common philosophy: healing through restoration rather than suppression. They do not force the body to behave differently. They provide the nutrients it has been missing, so it can remember how to function properly again. And as we continue, you'll see that this theme runs through every drink on this list: nourishment that teaches the body to find its balance. And as we come to the final drink on this journey, I want you to take a moment and think about what we've really been talking about. It's not just about recipes or ingredients. It's about giving your body the tools it needs to heal, to balance, and to thrive. The last drink I want to share with you is something so simple, yet profoundly restorative: a warm turmeric and honey tonic. This ancient combination, used for thousands of years in Ayurvedic medicine, is not only soothing for the body, but also a natural regulator of blood pressure and muscle tension. Turmeric contains curcumin, one of the most powerful anti-inflammatory compounds known to science. When you combine it with a bit of honey, a natural source of trace minerals and antioxidants, you get a drink that helps the endothelium, the inner lining of your blood vessels, relax and function more efficiently. That means improved circulation, reduced arterial stiffness, and yes, fewer painful cramps at night. To prepare it, simply warm a cup of water or milk. Oat or almond milk works beautifully, and add half a teaspoon of turmeric, a pinch of black pepper, which boosts curcumin absorption, and a teaspoon of honey. Drink it about an hour before bedtime. The warmth of the liquid will calm your nervous system, the turmeric will ease inflammation, and the honey will help stabilize blood sugar levels through the night. One of the hidden reasons many older adults wake up with restless legs or cramping. Now, imagine yourself sitting quietly, the world slowing down, as you take small sips of this golden drink. Feel the warmth traveling through your body, relaxing your muscles, calming your thoughts. This isn't just a nightly habit. It's a ritual of care, a way of telling your body, "I'm listening to you, I'm taking care of you." Because that's truly what health is. Not a list of rules or restrictions, but a daily conversation with your body. But let me remind you of something even more important. If you've been struggling with high blood pressure or cramps, don't look at these symptoms as punishments. They're signals, your body's way of asking for attention, hydration, minerals, rest, and care. And through these drinks, you're responding with kindness and intelligence. Before we close, I want to thank you for staying with me through this journey. It tells me you care deeply about your health and that you want to understand what your body truly needs. And if you found this information valuable, I invite you, from my heart, to subscribe to this channel. Here we talk about health not as something distant or complicated, but as something you can nurture every single day with knowledge, with love, and with small, consistent choices. Every week, we bring you new insights, simple yet powerful routines, and natural ways to restore your balance, especially designed for adults like you who understand that health is the real wealth. So go ahead, click that subscribe button, and join this growing community of people who are learning to age with grace, energy, and clarity. As you begin to integrate these 5 drinks into your routine, the beet and lemon morning shot, the banana and spinach smoothie, the ginger cinnamon tea, the hibiscus infusion, and the turmeric honey tonic, you'll start to notice something remarkable. Your mornings will feel lighter, your legs will ache less, and your blood pressure readings will begin to settle into a calmer rhythm. And beyond the physical benefits, you'll begin to sense something even more precious, a feeling of control returning to your life. Because true wellness isn't about perfection. It's about awareness, about noticing what helps you and choosing it again and again, day after day. So tonight, as you prepare your next drink, remember, healing happens not in a single moment, but in every small choice we make. Here's to your health, to your heart, and to the calm, strong body you deserve. Thank you for watching, take care of yourself, and I'll see you in the next video.